The Addiction Podcast, Point of No Return.
Hey, everybody. Thanks for tuning in to the Addiction Podcast, Point of No Return. Today's episode is going to be very exciting. It's with a gentleman named Stephen May, who was a whistleblower for Purdue Pharma and the opioid crisis.
Hi, my name is Amy Newman, and my husband Bobby and I have a business called Newman Intervention Services. We provide intervention services for families who have loved ones struggling with drug addiction. Our goal is to help individuals get the support and treatment they need to overcome addiction and start on the path to recovery. With our personalized and compassionate approach, we guide families through the challenging process of getting their loved one into rehab and onto a road of a healthier future. Together, we can make a positive difference in the lives of those affected by drugs. If you or someone you know is in need of an intervention, don't hesitate to reach out to us. Let's work together and bring hope and healing to those battling addiction.
Call 866-989-4499 today and say the word podcast to get a 10% discount. Or go to newmaninterventions.com and type in the word podcast for a 10% discount. This service comes with a free 1-hour consultation with Bobby. Steve May.
Recording accepted.
Okay, good. Steve May, I'm happy to have you on the podcast today. We have talked a lot over pretty much since the beginning of the podcast about the opioid addiction and Purdue Pharma's role in that. And you have a personal perspective on how that kind of went down. So tell us, you worked at Purdue, is that correct? Hello, I'm Joni Siegel, the host of the Addiction Podcast. In 2022, over 100,000 people died from drug and alcohol abuse, and that number is growing daily. Fentanyl poisoning, pot, cocaine, heroin, and even psychedelics and alcohol all contribute to this crisis, while we're bombarded with promotions from thousands of rehabs. Newborns are born addicted, and the majority of homeless people struggle with drug addiction. Drug dealers exploit online resources to sell to teens, and antidepressant use is spiraling out of control. This podcast features brutally honest guest interviews revealing harsh realities and offering hope and solutions through their stories. We don't sugarcoat anything. Guests speak raw and real. More importantly, you'll find inspiration to understand, overcome, and achieve recovery, whether for yourself or to help others, some within your own family, many among your friends or associates. Whether you're seeking help or just a glimmer of hope, our podcast equips you with the latest insights to confront this generational battle. Many listeners tell us they want to join the fight, but do not have the time or money to act, lobby, or just help. If that's you, go to www.patreon.com/theaddictionpodcast and see how you can help.
Yeah, it was. I joined the company in November of 1999. And I stayed with them until January of 2005. I was a representative for the company in southwestern Virginia and parts of southern West Virginia. So if anyone is familiar with the geography, that was sort of the epicenter of the beginning area of the entire opioid crisis. In fact, things blew up in my territory and the surrounding territories in that lower Appalachia area before they blew up in any other part of the country. So I have a perspective of seeing it. I also have the perspective of, man, I wanted to get the problem resolved so that people, because I also recognize and even after Purdue, I worked in pain management. Not in an opioid setting, but just finding, good pain relief for people. So I recognize the need that people have of having pain relief. At the same time, we've got conflicting, not agenda, but challenge. I mean, conflicting pathways that would come together. So yeah, I spent time with Purdue, and thanks for having me on.
There you go. Absolutely. Steve, I think that probably we know that there were people at Purdue who did not have the best interests of people in mind. They were looking at the bottom line more than anything else. But I don't believe that that's true about every employee that was there. So, now the fact that now you want to help be part of the solution, which I think is a big deal, I think that's important. But what raised a red flag for you? How did you realize that there was something maybe a little funky with what Purdue was promoting?
Yeah, absolutely. So, just to give you a little background, before I became a drug dealer for Purdue, I actually was in law enforcement. That's what I did, during college and right after college. I was a police officer, not in the southwestern part of the state of Virginia, but I was a police officer in the southeastern part of the state. And so, when after I became a rep for Purdue, I knew going into that company at the time that it had one of the best, stellar. It was the place to work at that time,
Hmm.
when it came to the pharmaceutical industry. That they had very high standards for the type of people that they would recruit into the company. You had to be in the industry a minimum of a year and a half before you would even be qualified, and you had to be top 10%. You got to prove it and such. And so my point in sharing that background is going into Purdue, it was the place to work at the time. I was also very familiar with it because I was at the time working for another pharmaceutical company, also in the opioid market, the short acting opioid market. And so at the time in 1998 and 99, there wasn't a whole lot of pushback. And so to your question, when did I really start, seeing the problem? Well, it happened almost immediately after I joined the company. In my first month going out into the field as a representative, being new to the company, they have somebody come ride with you that's got experience. And at the time, the national sales rep of the year, who was based out of a community in Ohio, came and worked with me. And we were visiting doctors like we normally do. And I stopped in a clinic in Lewisburg, West Virginia. I'll never forget it. This is in January. I won't say I know the date, but it was late January. And we were in the doctor's office. They're used to seeing drug reps, and the doctor saw us and probably saw the name tag and said, "Hey, step into my office." And so we stepped into her office and waited a few minutes till she got done seeing a patient. And then a few minutes later, she comes in. She goes, "Hey, I just want to let you know I'm never going to prescribe your product again because I had a family member, and I'm not going to get into it how close of a family member, but a family member and her family had within a week or two prior to us being there, had overdosed on OxyContin, you
Wow.
know, and died." And so that was a wake up call to her. It was also to me and the rep that I was working with. And it was, you don't, like I said, I can remember where I was and when it was. You don't forget moments like that. And so we ended up, you know, you know, leaving her office and going and sitting down and almost spent the whole day just going, okay, so how are we going to handle something like this? And really, the reality is, she had been with the company for a number of years, probably 5 to 7 years at that point, had never heard anything that extreme coming out of a doctor's mouth. You would hear, anecdotally, "Oh, there's a problem with, people, buying and selling and abusing, opioids and such," but it just wasn't it didn't hit that close to home. But in this case, the doctor is saying, "I have an immediate family member, and I'm not using your product anymore." And it seemed like maybe my radar went up at that point, but it wasn't very long after that that just headline after headline started coming out in the media. And I was working out of Southwestern Virginia, which is Roanoke, Virginia. And so we had a very aggressive reporter for the Roanoke Times that just, you know, whenever there was an article about OxyContin, it just started growing and growing and growing. At first you'd see maybe an article once a month,
You are listening to the Addiction Podcast, Point of No Return. For more information on the podcast or to reach out if you have a story you would like to share with us, go to our Facebook page by the same name, or you can email us at theaddictionpodcast@yahoo.com or go to our website, theaddictionpodcast.com. And please remember to subscribe to our podcast wherever you listen to podcasts and give us a 5-star review. We appreciate you listening to the Addiction Podcast, Point of No Return. We don't do this podcast because we are former addicts. We don't do this podcast because we have loved ones who have suffered from addiction. We do this podcast because we feel that addiction is one of the biggest problems facing the world today, and that no matter who you are, no matter your religion, no matter your income status, no matter your race, no matter anything about you, addiction affects you. Many listeners tell us they want to join the fight, but do not have the time or money to act, lobby, or just help. If that's you, go to www.patreon.com/theaddictionpodcast and see how you can help.
Once every few weeks, then it became more frequent. But it was early on in my tenure with Purdue that we started seeing the issues. And then I would say within about 6 months, my territory, when I had joined the company, my territory was ranked number 30 in the country. So I was definitely in the top 5% as a territory. So I was taking over a territory from a previous rep that had done very well. And all of a sudden, you could see the prescription numbers started dropping off. And that's, at first, the company is looking at me going, hey, your numbers are falling off. This is historically a great company. You should be doing better. Well, no, we've got a little problem here. We reported what that doctor said, up our chain. We have to document things like that. But it just became more and more frequent is the point. And the more frequent it became, the more pushback that the doctors would have when it came to prescribing the drug. So
what did corporate say?
That's a very good question. So we would bring it, we would bring it to their attention. We're waving the flag. I would say, they said a lot. At first it was you could sell through this, and it was a matter of working with my district manager and the regional manager, and we had district meetings every 6 weeks, and we had regional meetings quarterly. So we were constantly being educated and re-educated on our sales techniques and our processes and such. But really, from corporate was, you could sell through this. This is a limited thing. It's not the drug's fault. It's the people. It's the doctors that are over prescribing. Anything that they could say to come up with it. But one of the things that I thought was really neat or really interesting when I look back on it, how many people from the corporate would come and work with me in my position. I had one of the national training managers came and rode with me. I think 2 of them. And it was a constant, okay, the more I was raising my hands about what I'm seeing, my colleagues in neighboring, neighboring territories would also were saying the same thing. Yeah, we're seeing this. And the thing about it was the district that I was working in terms of the way that the company laid out their sales management, I was in Roanoke. I handled much as, like I said, southwestern Virginia and then southern West Virginia. And then if you look up, throughout the state of West Virginia, almost the entire state of West Virginia was basically the center of our district. And then all the communities, whether it's Eastern Kentucky or the lower eastern side of Ohio, going all the way up into the Morgantown, West Virginia area, that was all part of our district. And I would say that started really bubbling up as a hot spot. And then before we knew it, I would say within, 4 to 8 months of me being with the company, it wasn't just me that was raising the red flags to the company. It was the entire district. Our district manager, was raising the issue to the point that we even had another unusual thing, we would have executives within the company, come and attend our district meetings that, like I said, happen every 6 weeks. We'd be there for 2 days together, and then all of a sudden you see an executive like, Jim Lang, who was the vice president of sales at the time. He came down to our district meeting, and I think they were trying to figure out, okay, what's going on? Is it hype? Are these reps just not selling well? And I would have to say that for me, and I would also venture to say for my other colleagues, a majority of the pushback was, "You could sell through this. This is why you're a sales rep. You can, this is isolated problem. It's not. We're not seeing this." That was another thing we would constantly hear. We're not seeing this anywhere else in the country.
Wow.
Well, within a year and a half, it was everywhere else.
Yeah. Yeah.
Whether it was New Orleans or Myrtle Beach or Florida or other parts of, Southern Appalachia, it started spreading. Maybe yeah, I'll say this, I ended up one time, contacting, one of my managers that I worked for, actually a sergeant that I worked for at the police department. He's over in the eastern part of the state, and I called him up and I said, "Hey, are you guys seeing any problem with OxyContin?" He goes, "I don't even know what you're talking about." And so he wasn't even familiar with the drug at the time. So it was, to a certain degree, there was an isolation of the problem in our part of the state more than other parts of the state where other, class 1 narcotics were typically the drug of choice on the streets.
And this was still 99, or are we into the
This
2000s?
we're right. Yeah, I went out into the field the first of 2000, so it was the what I'm describing now is basically my first year
I got it.
within 2000.
I got it. I have to ask you a tough question.
Okay.
Why did you stay? Because you said you worked there till 2005.
Yeah, I did. Honestly, I actually became pretty passionate about what we did. My previous company, that I worked for was also in the pain management arena. And, I've known people who have personal, family members and friends that have severe chronic pain issues. And really, the truth is, I wanted to see, relief. Didn't really recognize that, to a certain degree, you know, you've you've had some of the company Kool-Aid, and the sense that you've been indoctrinated into the big pharma, um, sales messaging. At the same time, there there was a balance, a lot of my work was not just in going into practices, but was also going and working with cancer centers and hospice centers. And so you would actually see, on one hand, the benefits of, people having pain relief, but at the same time, you're juggling that with, okay, so these family practitioners or these pain medicine practitioners are prescribing a lot, and it's ending up on the streets. But, you know, I
But there
actually
there
became
was a
passionate about
market
it.
for it, basically, in
There was.
with clinics like end of life clinics and, um, yeah, people who are dying of cancer and who need something to help them manage the pain. It just wasn't the pain clinics or those doctors, the pill mills, if you will.
Right, right. And at the same time, I mean, no one is better at marketing than big pharma is. They can push a message better than any other industry I can think of. And so at the same time, we're out there working, the company's growing. I'm seeing, meanwhile, whether it's 2000 or 2001 or even 2002, there's other parts of the country that were having severe growth in the product, I mean, I went from being, like I said, in the top 5% of the company to being the dead last rep in the whole company
Hmm.
in terms of sales, you know?
Wow.
There were empty territories that were doing better than my territory was, you
Wow.
know? So and we were and the Purdue compensation package was weighed heavily on bonus and, commission. It was more of a, some pharmaceutical companies had a higher, base salaries, lower bonuses. Purdue had lower base salaries and higher bonuses. So it wasn't about, for me at that point, because I think I went 2.5, maybe 3 years without even seeing a bonus, you know
Wow.
a bonus experience. At the same time, I got actually pretty involved, with, trying to figure out, a resolution to the problem. I created, working with some doctors who, and you also work with doctors who really have a, a good intent in terms of wanting to treat their patients as well. We wanted to figure out, how to stop the opioid crisis. So we created a regional pain society where we would have doctors and pharmacists would come together on a monthly basis, have dinner together. It was not a promotional thing. It was an opportunity to get people to talk and to meet each other. There's a lot of times doctors who didn't even know the pharmacist within their community. You know, so got pretty passionate about that. I went to the some of the events that at the time the lieutenant governor had put on, or the attorney general, I can't remember which. One of them was running for the next higher office and was making a big deal out of it. And so, they would have town halls and such. So I wanted to really find a a solution to the problem, to the point, I can remember the one time I walked into a local sheriff's department in Pulaski, Virginia, and I walked in, I said, "Hey guys, I'm the OxyContin rep." And it's just, it was a small town sheriff's department. The whole room just kind of just stared at me like you were the devil,
Right.
because that's, they thought that I was the source of all the problems. But I walked in there actually with the intent of saying, "Hey, how can we work together? How can we, help the people that actually truly do need pain relief without adversely affecting, the rest of the community as, through whether it's through, drug diversion or, patient personal abuse,
Right. What did what did Purdue think about, or did they even know about, like, you setting up that, what'd you call it? The pain with the
Yeah, I had
doctors, pharmacists?
Yeah, I called it the Roanoke Pain Society. We
Okay.
we had it we had another I had them geographically based because, for those that aren't aware of the geography, you've got mountain ranges that separate different communities from one another. So, it was easier to have a pain society over here and another pain society a little bit further west. And so, we would just basically come together and, the doctors would talk. They would talk about people. They would actually learn, "Oh, really? You're seeing that patient as well," you know? And it wasn't, it was sometimes it's pretty easy to put the blame onto the doctors as the overprescriber, but a lot of times at the time, and this is really early on in the whole, opioid epidemic, a lot of these doctors, we're still on paper at that point when it comes to prescriptions, you know? They don't know that a patient is going from doctor to doctor,
Mm,
and they didn't know that there were teams of patients that were working together
mm.
to go from doctor to doctor.
And also, Steve, it's my understanding that a lot the doctors were lied to. They were told that OxyContin was not addictive, or it was addictive in less than 1% or something like that.
That's very true. That's part of the marketing,
Right.
and having been involved with that as well. I mean, I'll never forget, that the line that we were taught to speak, that the long-acting delivery mechanism is believed to reduce the abuse liability of the drug. That was straight out of the package insert that I had memorized,
Okay.
and so if a doctor raised an issue of abuse, it was one answer. If they raised, an issue of an overdose from somebody that wasn't a patient, well, those aren't the patients that we want you to prescribe for, So there was always, like I said, big pharma can market better than anybody else, and they had a message for everything, almost almost like a checklist. If you had this response from a doctor, then your answer is one of the following 3 or 4 points. If you had another point from a doctor, here's another set of points. So at the same time, we really wanted to resolve the issue. And I would say also too that it just kept bubbling up. I really felt like to a certain degree, getting the doctors together, helping them to communicate with the pharmacists, even trying to get the law enforcement involved, because that was also my passion. I didn't want, I'd been in law enforcement. I didn't want to see this, happening in my community. So, um, just seeing if we could improve the communication and treating of the right people, then maybe we could, you know, help resolve some of the problem. But at the end of the day, the company still wanted you to sell, and I have to say that I was probably one of the reps that was constantly under the pressure of a potential termination for lack of performance, if you know what I'm saying, because
Mhm.
my territory was dead last for a long time, actually probably almost 2 years, until at which point the rest of the country came down, and what number of prescriptions that I had in my territory, well, those were outpacing percentage-wise other territories. So, but
So
the
you weren't
company
dead
still
last anymore.
I was close to it during my during my entire time there, to be candid with you.
I got it. So, Steve, we call this podcast the point of no return. And what that actually means is when someone who has been addicted, when they finally reach rock bottom and they go, okay, I'm either going to stop doing this or I'm going to die or I'm going to spend the rest of my life in jail. So, for you, what was your point of no return with Purdue?
Well, I had left the company, like I said, in January. I started, looking for my exit in late 2004. Left the company in 2005 after I secured another job. But after that point, I had moved on. I was in a completely different medical industry, different types of medical device product. Didn't really think too much of it. However, around that same time, 2005, 6, and 7, I did get involved with a ministry out of Rona, Virginia called the Rescue Mission. And when I started working at the Rescue Mission, which was well, that's exactly what it is. It was for um, people who had been either alcohol or drug addicted, and they were needing some help and working through it. That rescue mission was something else. It was phenomenal. I got involved as a volunteer there, specifically doing music and developed some phenomenal relationships with people who had been addicted to OxyContin specifically. And as a matter of fact, I could see their faces right now. Some of my friends, and when I say friends, we became close. Um, During that time, 2005, 6, and 7, working with the rescue mission, I really became pretty passionate for them as well. And then that led to around the 2008-9 timeframe. I forget exactly what date. That's when I found out from, the wife of my former manager that, "Hey, did you know that we had been promoting the product and we had been making false claims about the product?" You know? And then that's when I stepped up and got involved as the whistleblower as well.
Cool.
So,
I
it
think I think what's important in your story is that you're doing what you can to take responsibility for the opioid crisis, and I think that that's important.
yeah, so that's really what, I reached out to you guys because, I want people to know what I learned after. This is years after I left the company. And my district manager had formally, brought this particular, lawsuit against the company, but it was dismissed. Purdue had some of the best lawyers in the world. They prided themselves. At one point, I think I remember the executive saying at a national meeting, "We've had over 600, lawsuits against us, and we've settled none." You know, that they were doing pretty well. And I also know, having I listen to people when they talk, and my point is, I'll never forget, listening to one of the executives, specifically Jim Lang and Michael Friedman talking one day, and I'm standing not too far from them, and they were explaining, "Oh, yeah, well, Purdue has, this philosophy that we put a certain amount of money towards the rainy day fund," and they were saving up money for, for the rainy day when the lawsuits started coming. So they were able to crush a ton of lawsuits. And so my former manager, Mark Ratcliffe, had brought the suit, and then and it was thrown out because on a technicality, his suit never saw the light of day. But based upon how the law was written about this, I was able to bring the suit along with his wife, and we brought a very similar suit in the sense that, hey, I actually know firsthand that I was out promoting this product on the basis of this clinical study and didn't know at the time that we were promoting it, but I found out later that what we were promoting was a false claim. You know, they had taken a clinical study, they had manipulated the information and, almost like a Jedi mind trick, made the doctors to believe um, things about the efficacy of OxyContin versus morphine that weren't true. And it was a very manipulative way of explaining to the doctor, well, this is actually better than prescribing the long-acting morphine because, um, it OxyContin is twice as potent as morphine. You're not going to have to give as much. And now I'm going to really, I don't want to dive too deep into the weeds on that, but it was a false claim, you
Right.
know? And when you make a false claim like that, and I can look back in time and once my case was had gone to trial, it was initially dismissed, and then we won on appeal at the Fourth Circuit. Purdue appealed the Fourth Circuit's decision to the United States Supreme Court, and they had decided that the lower court was sufficient, and so therefore that remanded our case back to trial. And then once we got into trial, we went through discovery, and it's when we got through discovering, and I'm being given, you know, thousands, tens of thousands of documents, on microdrives, and also, printed documents as well, that you really get to see this company they knew early on that they were making claims about the efficacy, the potency of this product relative to morphine that was not true. And they were being called out on it. And what's even worse, in my humble opinion, is the FDA also knew,
Mhm.
you know, that these false claims were false. And you know that when you read letters from administrators of a foreign entity, like for example, I'm thinking specifically of the administrator for the Japanese version of their FDA, and Purdue is trying to make this claim, oh, the relative potency of OxyContin is 2 to 1 versus morphine, and that FDA, that I don't know if it was called FDA, but
Right, right.
whatever that agency was in Japan, they're saying, no, 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 you can't make these claims, you know, and then through when you go into discovery and you start reading the emails, that are going back and forth between the executives, the medical directors, the legal people about this particular topic, you can see that they knew that this was something that could have undone their entire, as they call it, their franchise. You know, they uh, being able to. A lot of people don't know this, but Purdue had a product called MS Cotton that had been on the market since the mid '80s. Okay, well, that product in the 1996 through 1998, maybe 99 range, that product was going to become generic, you know? And once it goes generic, then all those prescriptions were going to go to a generic company, a competitor, and they were going to lose that. I think at the time it was about a $500 million, maybe 800. I don't remember the exact numbers, but let's just say it was a $500 million product, Somebody can correct me, but well, they needed to figure out a way to capture that revenue stream.
Right.
And the way that they were going to do that was to bring the OxyContin to market. It was going to be a true 12-hour drug instead of a 8 or 12-hour drug. And they were able to, and then this particular clinical study that was the basis of my lawsuit, they were able to not only manipulate the data and manipulate how the data is interpreted into a very favorable thing. The thing is, when they're saying, hey, it's a 2-to-1 conversion versus morphine, that's true. If it's a one, well, here comes the balloons. Didn't mean to do that.
What that was?
I think I'm putting my fingers up and doing two
Oh,
things, and it's. But my point is that it is true. It's a 2-to-1 conversion if it's just one dose, a single dose for one day. But because morphine accumulates in your bloodstream over time, that relative conversion ratio is not 2-to-1. It actually becomes 1-to-1. And so what Purdue was able to do with this particular data, I think they knew that, hey, if we could just get them switched over to OxyContin, by claiming it, hey, it's only it's twice as potent as morphine. You're only going to use half as much, as you would use.
And less than 1% get addicted.
Right. When the reality is, all of a sudden, people were taking as much, on a milligram per milligram basis. They're taking as much OxyContin as they were MS cotton or morphine. All of a sudden, now you're getting these people are getting higher doses.
They need more and more and more.
The company is making bank a lot of money on it because there was a huge financial gain in that. If you're saying, hey, it's twice as potent, doctor, you're only going to have to prescribe half as much.
Right.
When the truth is, no, you're actually going to be prescribing as much as.
Yep.
And now that drug now the MS Contin has gone generic. That would have been a significant savings. And now you're prescribing as much of a much more expensive drug. I calculated it once. I think that they ended up making out to the tune of at least $1.2 billion in extra revenue off of that false claim.
Well, we know it's all about the money, so that makes sense.
Oh, absolutely. And they knew it, and they knew that they had to protect that particular. And I would say this, that this particular clinical study and the way that they were able to use it, because they were able to be much more financially profitable, significantly more, then all of a sudden they're able to pay their representatives more, And I don't know how much you all in your podcast have gotten into how much Purdue representatives were making, in other parts of the country. Purdue was the highest paid. They had the highest paid sales force in the industry, in that, let's say 98 to 2002, maybe 2003 timeframe.
Interesting.
They had reps that I can remember. I think it was in 2002. They had a rep that made like $80,000 one quarter in bonuses.
Wow.
Then $120,000. Then $140,000. And that rep ended up making $240,000 in one quarter.
Wow.
And the thing is, the management's going, hey, there's no opioid crisis over here in this community. These reps the doctors are prescribing it left and right. It's the greatest drug in the world to help patients in pain.
What's your
Steve,
problem?
What's your problem, Steve?
Yeah. What happened with your lawsuit? Is it all done? Are you?
Yeah, unfortunately, we got into discovery, and so it had been dismissed. We won on appeal on the dismissal. Then we go to trial, go into discovery. And the week before, just a few days before, we were to start deposing people like Michael Friedman and other executives within the company. All of a sudden, my case got dismissed again on almost the same basis that it had been dismissed before. And my humble opinion is that judge did not want this case in her court, And I've since done a lot of research on it, and Um, I personally believe that there was a lot of influence happening to get that particular, case dismissed. And so it was dismissed, we appealed, and, once we lost the appeal, what this judge was able to do was she was able to dismiss it almost on the exact same concept that she had dismissed it 2 years previous or 2 or 3 years before. But this time, because of the way that the circuit court had written their decision, she knew how to better write her opinion on
Mm.
that dismissal. And so because she wrote it better the second time around, we weren't able to prevail. And so therefore the all the information that we had gained in discovery and we would have gained in the depositions of the executives falls flat, and it never saw the light of day and was dismissed, and that was it.
Okay.
And after that, that was the end of my rope in dealing with that.
Okay. So what's next for you? Because it doesn't sound like you're just gonna sit back and take it.
No, no. Well, there's not too much I can do at this point, with regards to this case other than, talking with you all. I see other cases very similar to this. There's another identical case in concept, a False Claims Act case, that has been brought against another pharmaceutical company. I want to see that particular case prevail. I'm not gonna say anything because I don't want you
No,
guys
no,
to
no,
get
no, no, no.
but there's another case that I'm highly interested in and am wanting to see them succeed in bringing that pharmaceutical company to accountability.
Well, good. And I think that
Because
telling your
that product.
story.
Yeah, go ahead.
Sorry?
I was gonna say because that product killed millions of people, so,
Yes, it did.
mm.
And, good for you, good on you for telling your story. And I think that, helping another lawsuit like that if you can, but also getting on more podcasts and on more platforms to talk about it. I mean, in this day and age with the internet, you can't really hide. So the more we put the information out there, the better it's going to be. That's my view. And we appreciate you coming on today and telling your story.
No, thank you for having me. If there's any bottom line that I would like to say to everyone, regardless of the product, if the pharmaceutical industry is pushing a product on you, read about it. Educate yourself as much as you can because they're not gonna tell you all the side effects. They're not gonna tell you, how it can kill you. They want you to take the product. So educate yourself. Don't rely on your doctor. Because your doctors are very easily manipulated by the pharmaceutical industry, and I saw that firsthand as well at Purdue. We didn't even get into that, but that was a whole 'nother.
Lots of
Purdue
money,
had
lots of
a
perks, lots of gifts, lots of, yeah, I know that.
yeah. So read about the product that you're taking, educate yourself, and make the best decision for yourself,
Yep. I
before taking.
I think that's perfect, and with any, um, luck, maybe somebody in the administration can get the drug advertising off the television, which I think would be huge. So, hoping that
I
will
would love to
actually
see that.
happen because yeah, because they say the side effects, but if you can catch them, good luck because 'cause they're said so fast and so quickly, it could cause this, could cause that, could anyway, you are
You
correct, you have to own your own health.
I have recently applied for jobs within the FDA, and HHS, trying to get into that aspect of the industry, but doing so, as the whistleblower.
Mm.
But nobody wants to hire a whistleblower, I can promise you that. So,
Yep. Nope.
um,
Well, we appreciate you, and we appreciate you coming on the podcast. So, if someone wants to keep maybe or up to more up to date on what's happening with Purdue, is there a website? Is there a way they can do that?
I to be candid with you, after I lost my case completely, I completely checked out of the entire, and to the point where, there were other lawsuits that were happening after mine. Yeah, quite frankly, becoming a whistleblower actually sort of destroyed my life,
Mm.
in the sense of being hireable by companies, regardless of the industry. Who wants to hire somebody that blew the whistle on their company? You know?
Yep.
So that has been a personal challenge for me, and that actually set me back quite a bit. So after my case was dismissed, it was scramble time for me.
Well,
So I wasn't able to follow it, but in recent years, more and more information has come out. I've watched the Netflix TV show about my old territory,
yeah,
and
that's dope
it's
sick, right?
yeah, it was interesting because that was about they're talking about the Roanoke rep there, and I'm going,
Yep.
well, that would be me or one of my other
Yeah.
colleagues in that area.
Well, we'll just say it
And
wasn't you, it was your colleague.
yeah, exactly. And even the stories, it was so many different stories conflated into one character.
Mhm.
So that wasn't me.
Yeah,
But yeah, so that to be candid with you, I checked out of it. But in
I
recent
understand.
years, I've been asked about this, and I've become much, much more involved in this sense, and especially in the last 3 to 4 years with this other drug that's, I really wanna be involved with it.
Okay. Well, thank you. Thank you for being willing to share your story, and onward.
Hey, thanks for having me.
Thank you for listening. Um, Hard-hitting interview, but important. And I think the key is you have to own your own health. And we've talked about this before. When your doctor says, here, take this medicine, you have to ask, what are the side effects? I learned the hard way to do that. And, well, not really the hard way, but I learned to do it when my kids were little because I was told to drug my kid. And I said, what are the side effects? And she told me, and I went, oh, okay, not doing that. So, yeah, you have your own health. You need to own your own health and question your doctor. And we'll have another interview next week.
You have been listening to the Addiction Podcast, Point of No Return. For more information, reach out to us on Facebook or go to www.theaddictionpodcast.com. Our email is theaddictionpodcast@yahoo.com.